So this is a slider glider tensioner for the sciatic nerve. So you're going to sit in a slouched position to start, and if you imagine that we're talking primarily about the back side of the body here, if I stretch my leg out, pull my toes up and slouch, you can obviously understand that I'm taking my whole spinal cord and sciatic nerve and I'm tensioning it. I'm bowstringing it around my ankle, around the back of my leg, slouching around, making it longer that way, okay? So for this, to mobilize this nerve, we're going to give it a few different variations. So number one, we're going to start in a slouched position, point my toes down, and I'm going to tension from the bottom of the nerve without tensioning the top of the nerve. So I'm going to offload the upper part by extending my neck. So this is shortening up here, and now I'm going to pull my toes up and point my toes down. And that is me putting tension at the bottom part of the nerve while the upper part is offloaded. So the whole system gets a little bit of tension, drawing it that way, and then relax. I can then reverse that and point my toes down and tension from the top down. So this is now shortened at the back here, and now I'm going to drop, slouch, and bend my chin to my chest, and I'm tensioning from the upper part of the nerve. So obviously this is all connected, so we're moving the nerve within its sheath, producing flow, helping it to improve. Just like that. And again, 10, 15, 20 repetitions is nice here. I can try to move the whole nerve towards my toes or the whole nerve towards my head. So if I want to move the whole nerve towards my toes, I offload and pull my foot up. If I want to move the whole nerve towards, that's the whole nerve towards my toes. If I want to move the whole nerve towards my head, I point toes down and put chin down. So I can move it like that. And then if I want to go into the most tensioned position, I can drop my chin down to my chest and pull my toes up towards myself. And that gives me a full kind of bowstring tension effect. I offload that way. So 4 variations. Number 1 is just tensioning from the bottom. Number 2 is tensioning from the top. Number 3 is moving the whole nerve towards my toes, towards my head. And then the 4th one is tensioning, so moving it towards. So putting the most tension into the nerve and offloading. You can do this on the side that's symptomatic, and you can also do it on the opposite side, because both sciatic nerves join to a spinal cord. So if I have a problem in my right leg, I can still move my whole nerve in a less symptomatic way for me on the spinal cord level, which obviously affects both sides, by using the asymptomatic or the non-painful side. So we can do all of this both sides, okay?